Happy New Year, ACPS families. This is Dr. Hutchings, and I just want to welcome you all back. As you all know, we are back in full effect, and soon we will be back into our school buildings. I just wanted to first start off by saying that we do have some resources that we're going to share with you all if you need anything to talk with your children about some of the events that happened yesterday, some of the very disappointing events that happened yesterday. I hope that some of the conversations that you're having with your children is that it is so important for us to one be kind, yes, to be advocates, but to make sure that we are being advocates in a way that is not putting people's lives in jeopardy. Yesterday events, as you know, it was a historical period in time. Really just shows that we have a lot of work to do, folks, across our country, and it is so unfortunate that we are still at a place in 2021 where we're just not being good representatives of what democracy and citizenship should be. But I just want you all to know we will be sharing some resources with you all in our ACPS Express to help you talk with your children and to help them to really just be able to process what's going on across this country. It's difficult even for me as an adult to process it. I'm sure it is the same for you. But this is some of the reasons why it's so important for us to continue working through removing barriers and building character and helping our young people to understand the importance of working together and collaboratively and just in a caring format. So I'm going to get into the message that I really needed to share with you all today, and that is to talk a little bit about our decision matrix for reopening our schools. We have been talking about the moment to reopen our school buildings over the past several months, and we're getting closer to that time. Our timeline, as you all know, is to begin to transition students January the 19th. And this is all based on our community health metrics, of course, as well as our school impacts. And our community has really been asking for a matrix to help them understand how we make our decisions in regards to reopening our school buildings. So we have worked collaboratively with the Alexandria Health Department and our staff, and we have developed a matrix pretty much using all of the resources that we've used to make our decisions thus far. So we're using the Virginia Department of Health's guiding kind of like guidance report that they shared with us back in July that was updated in October. And I believe it's going to be updated at some point in the near future as well. And then we also are using the guidelines that came out of the CDC and the VDH, which is the Virginia Department of Health, in regards to community health metrics. So when you couple that with our local school impact, so for example, we've been talking about our staffing and our capacity. Well, our staffing and capacity, that has an impact on our operations of our school buildings, from being able to mitigate the health and safety measures within our schools, whether it's transportation, whether it's food services or school nutritional services or health services, or even our instructional delivery within our schools. Staffing and capacity does have an impact on that. So we've coupled both the school impact and the community health metrics to provide a clear picture of how decisions are being made in regards to reopening. So I want to just go through really quickly what this matrix means and what it is for each and every one of you, because some of you may look at this matrix and you may say, well how do you read this, Dr. Hutchings? Well, exactly what does that mean for us? So I'm going to just run you through how this looks. So first, I want to talk a little bit about the levels of school impact, because our staffing and our capacity, which we've been talking about over the past several months, that they will have a significant impact on our facilities, on our transportation, on our health services, and our school nutritional services, as well as any type of health mitigations that need to happen if they are strained or if they're critical. So we show the different levels of school impact, and our normal level would be, if we're between 175% of our staffing and our capacity, we can function the same way we would, during our normal times, whatever normal used to be. Um, right now, we are in a what we call strained level of our school impact. We're about 50 to 75% of our staffing are available, and our capacity is available within our schools. So that doesn't mean that we can't function, but it does require us to function at a more modified or hybrid level. Um, and hopefully we won't get into a critical level of school impact. But if we were to get into a critical level, that is when we have less than 50% of our staffing and capacity, which is going to cause some significant concerns as well as issues for operations of our school buildings. So that is the levels of school impact. As you all know, Dr. Herring, if you've been following, he's been talking about our community health measures, and that's very important too, because with our community health measures, we're looking at the number of cases per 100,000. We're also looking at our positivity rates in the city of Alexandria, and that is, the percentage of new positives in the city of Alexandria. And right now, we're at one of the highest levels that we've been during this particular time. Um, so we have to couple, as I said, these factors together to make a determination around our decision making. So when you take the level of community transmission and you take the level of school impact, what we then do is we begin to look at, when we're looking at our community transmission, are we at a moderate level of risk? Are we at a higher level of risk? Or are we at the highest level of risk? And when we are at the highest level, which we currently are at the highest level, and if you, I just explained to you that we're at a strained level in regards to our um, staffing and capacity. If I had to make a decision today on whether the school buildings would open or not, because we're at a strain level and because we're at the highest level, if you look at our decision matrix, you will see that we would continue to be at 100% virtual based on the metrics and the data that we have as of right now, meaning today. Well, we're going to be doing this every Monday for our community so that the community will always have insight to where we stand with regards to reopening our school buildings, as well as the justification for it and how we're coming to that conclusion. So each Monday, you all will receive this information via video as well as in print for all of our families. And it will give you some insight to what our decision is around reopening our schools. So that means this Monday, which is January the 11th, you are going to hear whether or not our metrics are allowing us or affording us the opportunity to open our school doors on January the 19th. So we'll always give that information each Monday, and you'll always have this a week prior to whenever we're scheduled to transition into reopening our school buildings. In addition to our decision matrix, we are also going to be providing our families who have selected hybrid or the hybrid approach. They will be receiving their student hybrid schedules 2 weeks prior to them transitioning into our school building. So any student that is scheduled to transition on January 26th, on January 11th, they will receive their transition, their hybrid schedule. And they will have the opportunity, parents will have the opportunity to determine whether or not they still would like to pursue that hybrid schedule or not. So we want you to just know that we will be sharing those schedules 2 weeks prior to the time your child is supposed to transition. And this gives you just an opportunity to make a decision. Some families may choose to change their hybrid status due to many factors. One could be that the teacher is virtual, so they don't want to continue with the hybrid status. Another may be that they're concerned about some of the community health metrics. Another could be they're concerned about the new strain of coronavirus that is now in the United States of America. So there are a number of factors of why people may want to change. But we will be sending to you a schedule of your child's hybrid schedule, excuse me, 2 weeks prior to their transition date. And on that schedule, it will include whether the teacher's status is in person or virtual, because I know many family members or families have been asking about that. So we are making progress. I just want to thank all of our staff members who have been working tirelessly over the past several months to make sure that we're staying on top of this and keeping you all well informed. We will give our decision each Monday, and we'll be using our decision matrix. I hope that this is helpful to our community, because many community members have been asking for something like this. And just please keep in mind that as information is gathered, and anything that's made that's revised from the Virginia Department of Health or the CDC, we'll be making adjustments to our decision matrix as well. So with that said, I just want to thank you all for your time. I want to thank you for your grace and your patience. I know a lot of you are saying I don't have that much left, but please just hold tight for us. I mean, it is 2021. What a way to start off! I tell you that in the past, just from yesterday's events. But we are so much better together than we are apart, and we just have to stay the course and keep lifting one another up and speaking positivity into this universe. But I thank you all for your time today, and stay safe, stay engaged, and please continue to stay informed. Have a good day.